So I am not Melissa Moore at all, although some people think we are similar creatures. We're not. I'm Michelle Lazuka, and I'm from Community Corner Clubhouse and Hope House, and I'm here just to get the meeting started off, and then I'm handing it over to Mandy to talk about recovery coaching. I am a recovery coach. I went through her first training in Wausau, and I'm really excited to have you here to talk to us about how we can move this forward. Our community is ignited, and we're interested in how we can push this forward. So today she's going to give us some tips and really describe what this movement is and how it will fit in our community. So before we get to Mandy, there's some things we need to cover for the AOD Partnership Meeting. Call to order. And I need to report out for some things for Melissa. She asked me to remind you that the AOD Partnership is still in recruitment for a board member. Applications are available upon request, so if you know someone or are interested in participating on the AOD Partnership, please connect with Melissa. Also, they have a date scheduled for the second annual Recovery Summit, which is when I first met you. And we first started this conversation last November about our community needs, the gaps in our community, and opportunities for recovery systems within Maritime County. So it's kind of the year check-in. That date for that Recovery Summit is November 8th, and it'll be held again at the Jefferson Street Inn. Melissa will send out, I'm sure, lots and lots and lots of emails about that. But at that meeting, I know that we plan to do a check-in and also continue our development and our plan about where we're going as a community. And then I'm supposed to hand it off to each of you, and we'll do report outs and updates from our programs. So I'd like to go first.
Okay. Yeah, I'm Christy Keel, and I'm on the AOD board. I'm the vice chair of the board currently, but also wear another hat in that we are bringing a mural arts program to Wausau that is going to deal with different health initiatives, especially recovery. Those in recovery, so we hope to always have a mural art project going on with individuals in recovery. So it was recently, or if any of you were at the HEAL or Healthy Eating Active Living Coalition meeting last February, we had an individual come from UW that had previously been the director of Porch Light, which is the same kind of model out in Philadelphia. And so she presented, and from that a steering team was created. I'm the president of that board and filed for that to be now a new entity in the Marathon or Central Wisconsin area. And we are being sent by the health department out to Philadelphia to be trained in October, the end of October, with two main artists from Wausau. And so it's really exciting, hoping to start 2 projects up in the new year. So it's just something that if you ever want, we have a little flyer or like informational sheets, a website, all of that kind of stuff. So if you're interested in becoming involved, there's lots of different opportunities of how to do so. But and you can check online. We have links to different things like the Porch Light model. There's a there are some really awesome videos on YouTube from Porch Light Initiative out in Philadelphia that show what it can do and how it can transform individuals in recovery. So that's that. Thank you.
Any other partner updates? I can share for Community Corner Clubhouse. Some of you picked up our flyer. So our 4th annual signature event, which is Evening of Jazz, is scheduled for October 20th. It's at the Rothschild Pavilion. We have the John Grinder Big Band coming to perform. We have amazing silent auction and raffle items. 5 different food vendors. So I keep telling people it's very pork heavy. So if you like bacon, pork, meat, really essentially meat. There's a lot of meat at this event. But this is our main fundraiser for our event, and the proceeds go to support our operations so that we can continue to serve people in our community. So.
Plus today at 3 o'clock, there's a meeting at the clubhouse to talk about recovery coaching,
Yes.
where we're going in this community, right?
Yes, thank you. Thank you. Any other updates? No? All right, well then I'm going to turn it over to Mandy from Darjun. She's here today to talk. We had one session already this morning at 10. She's presenting at this meeting and then again at 1:30.
Yeah, I think so.
So full day of Mandy, and then you're going to be at Clubhouse this afternoon to talk about where we're going, what our recovery coaches need, and how we can keep pushing this forward in our community. So thank you, Mandy, for being here all day. And
Making me talk a lot.
yes, you're going to need some water. Would you like some water?
No, I'm good.
Okay.
So first and foremost, let's just kind of want to know who you are and what brings you here. You can start back there.
My name is Bria, and I'm from Big Brothers Big Sisters of North Central Wisconsin.
We love them. We work with the Green Bay
I'm also from
chapter.
Big Brothers Big Sisters of North Central.
Okay.
My name is Tammy, and I'm the manager of Ramlin Homes and Ramlin's Veterans Home and Sober Living. And I am a recovery coach. I just came to find out more.
Bob Wilcox, I'm a law enforcement liaison at North Central Healthcare Center. Just wanted to learn more.
Ashley Bowling, I'm a part of our Lincoln County Drug Free Coalition, so I wanted to see what is being offered in there. We hope to bring that to our area. I also am a mental health specialist at Ascension at a primary care clinic in Merrill, so working with the hospital up there too.
I'm Carly Zarger. I'm from the AIDS Resource Center of Wisconsin in Wausau. I'm trying to push it that all the people that are working with our Lifetime Clean Needle Exchange and Prevention get trained in recovery coaching.
Yep, good plan.
Yeah.
My name is Sheila. I work at North Central Healthcare. I'm here to gather more information and understand the program.
My name is Christy Keel. I'm on the AOD board, but I'm also an attorney that does guardian ad litem services in the area. So obviously recovery and different things along that line are a passion.
My name is Jane. I work at CCITC, and I'm here to learn more about the recovery coaching program.
Nancy Stencil, I work with Crisis Services North Central Healthcare, and I'm here to learn more.
Ron Alexander. I'm a retired AOD counselor and a new recovery coach, and just kind of here to kind of push us forward.
Awesome.
Michelle Zuka from Community Corner Clubhouse. I found out yesterday that Melissa could not be here, and so I'm covering for her for this meeting. But I'm excited to share my information and knowledge about recovery coaching.
So I'm Andy Southers. I am the CEO and founder of Darjun Recovery Community Center and Services. I have 6 years sober. I am originally from Wausau. My family lives out on Lake DeBay. We own 2 family businesses here, Norland and Tomcor. I was the troubled kid. So I have a felony for a 5th DUI that I received in Green Bay. My first DUI was in Marathon County. Well, it was actually out in the Podunks, leaving a place called Kim's Place, out down on X by Mosinee. I let a bunch of cows out all over the country roads. My dad had to call somebody in to gather, and I was in big trouble, and the first jail I ever went to was Marathon County's jail. I definitely did not make my father very proud back then, or with all the DUIs that I had in Green Bay. He even threatened to take my last name away on my 5th DUI when I went to treatment. He was that mad. So I did start Darjun in Green Bay, because that is where I live. I'm the kid that kind of ran away from the companies. So now, you know, a year later, here we sit where I'm actually back in Marathon County. So things do come full circle when you're in recovery and doing the right thing. My parents couldn't be happier that we have brought something that I've built to this county to try and help with services. And from my understanding, since the training, we've already begun helping in a lot of areas with our coaches here in Marathon County. So, going a little bit on our first slide here, up to the top, I'd say my left, that's Jesse Heffernan with myself. We began recovery coaching about 3 years ago when we heard about a model called CCAR out in Connecticut. We were told it was the only 100% approved model. So a little bit about how that got started was when we started Darjun, I started it out of my old bar that I owned for 12 years. I got sober and didn't know what to do with a building that I stupidly bought against my father saying, don't buy that. So I lost my liquor license to that bar and needed to do something with it. So We built the community center so people had a safe place to go, and we put a coffee can out that said suggestions. We don't really know what we're doing. Swear, it's still sitting there 3 years later. That coffee can built every service we have at Darjeon. The biggest service that coffee can built was recovery coaching. Everybody said when they came in, which made us a drop-in center then, we have nowhere to get help. Like, we don't have money, and insurance isn't helping, and we can't go to inpatient, and a lot of our family members were losing their children. And so the biggest thing we always got is, can you guys put some peer support services in? Can there be something other than sponsorship? A lot of people were scared of AA and NA. A lot of people still are, but a lot of people are. I'm in AA and NA. But the biggest thing was some of our newcomers would suggest, is there something other than AA and NA? What can we do? And so that led us to start researching, well, what can we do? We're in Wisconsin. You know, my recovery was in Florida. I spent a year in treatment there, and I also helped work for the treatment center and build a student leadership program there after I graduated. And I knew there were a lot of other pathways out there, and it wasn't just the 2 standard that you always hear about. And so Jesse and I found CCAR. So we became trainers in the model. Like I said, the first presentation, our first training was 7 people, and it was all of our really good friends we convinced to go through it. Nobody knew what they were doing, let me tell you. It was like running around with our heads cut off, like, oh my gosh, well, how do we do this? Like, no one even believes in recovery coaching. And you have me and Jesse with felonies going, well, how can we convince a state, let alone Outagamie and Brown County, that this is a really good idea when we have felonies? And like, we can't even get into the jail, and we're on probation. So I will say that Brown County is the first county that ever believed in us. And it took a lot of doors being slammed in my face. And we had our human services director, Eric Pritzel, finally go, Mandy, I'm so sick of you being in my office with brownies. And that's really, like, I brought him snacks all the time. And the jail, and probation and parole. And we just kept bringing them brownies that our addicts were cooking because we had a life skills program. And so we were giving them jobs to help get them into the community. And so I showed him this coffee can, and I was like, listen, this is what your community is saying they need, and you're not listening. And so finally he said, okay, let's figure out a way, let's do recovery coaching. Within that, Jesse and I started going to Madison, and we started going to a lot of state meetings, and we started to meet the people that were really important. And we just sat there and talked till they'd finally listen to us, and it worked. So 3 years, here we sit. We have a state grant that just got passed down for $2.8 million to 7 organizations to do recovery coaching within the hospital systems. We finally got it CCS approved, Community Comprehensive Services, under rehabilitation worker. We have contracts with juvenile and child protective services now in 2 counties. And we host 68 coaches within the entire state right now. So, and that is bringing some of the WASA coaches under Darjeon. We have a 100-person professional counseling liability belt that we hold for these guys with sex and molestation coverage. They are fully covered. Sometimes, I like to say, sometimes they're better covered than the counselors themselves, because they have to go into this with lived life experience, and they don't follow a lot of the same HIPAA regulations as you would as a counselor. So let's get into some of that works. But first of all, this picture down here, because I get asked about it whenever we do presentations. I just recently got home from hiking the Appalachian Trail. My intent was to go all the way. I made it 720 miles. I unfortunately had to come home for a brief stint for work, and because I had some stress fractures. And so I'd like to say this is pretty darn good, but in 2.5 years of doing this, we lost our first recovery. We had not lost anybody yet. And his parents had asked me to come get his ashes and to bring him with me. And that they wanted him spread on McAfee Knob, which is the most recognized part of the Appalachian Trail. So that picture is McAfee Knob. That is where I ended my hike. And I did get Joe up there on Mother's Day and spread his ashes. It's a very windy day. 100 miles prior to that, I fell off a mountain, 15 feet, and broke my ankle and was stranded for several miles. I did make it to a town after hiking with a friend of mine, with Joe. I couldn't quite feel my ankle, even though I'd been to 2 doctors in Harrisburg, Virginia. So I felt as Joe was one of my first recoveries I had ever had, not knowing what I was doing. And he had made it, about a year sober, relapsed, then we put him in treatment. And then unfortunately he got some bad stuff and passed. His family was the first family in our family services program we ever had at Darjeon. So I felt we were doing it to raise money for Darjeon, but I felt it my obligation to get him where his mom wanted him on Mother's Day. So I did manage to hike 100 miles more on a broken ankle and still get him there on Mother's Day, in which then I got begged to come home by Bell and Health and my fiance. So I got off that mountain and came home, and so thank goodness I did, because WASA needed a training. And so Melissa couldn't wait. And I got emails in my tent from Melissa saying, when are you coming home? Are you almost done with this trail yet? We need to get these recovery coaches in WASA. And so when I came home, I said, well, I'll never forget what she had said, because I said, well, unfortunately, I fell off a mountain and broke my ankle, but the good news is I'm home. And she said, oh, great. When can we have the training? How about a month? I was like, are you kidding me? So yeah, we had the training. So let's go into some things. So where are we at right now? Now these statistics have changed a lot, but I like to use these because I feel like they're more real than today's statistics. There's a lot of covering up and hiding today on what overdose percentages actually are. No county out there wants to say, oh, we have the highest rate with heroin overdose, and we're not doing anything to help it. So I like to use 2013 because it's when heroin really started the rise on things. And so they didn't have to fudge some of those numbers. 843 died from overdoses in 2013. In Wisconsin, those numbers are a lot higher now. 45% are opiate pain relievers, 27% heroin, which is actually risen now, plus 6,951 Narcan saves. Now there's a lot more Narcan saves now to date. Average age of an overdose death, 43. 59% were of those who died were men. 45% of emergency room visits are due to drug abuse. That is a lot higher now. 30% burglaries, 7% of vehicle thefts are drug related, 23% sexual assaults, 30% physical assaults are drug or alcohol related. Now add about 10% to all those numbers for 2017, sometimes 15 in some of the areas. Your hospital ones are a lot higher than that now. So young people in general aged 18 to 24 are more likely to abuse drugs. 90% of heroin users are white. 52% of users seeking treatment are women. 23 is the average age of someone with an opiate addiction. 75% live in small cities and non-urban areas. 81% of first-time heroin users abuse prescription drugs first. That has actually gone down. It's the only number up there that has gone down. And this is why we like to call it, it's about dating the bad boy. A lot of your young girls are dying today because they're finding themselves in that, like, we don't know who we are, so we need to connect with something. And so because heroin use is on the rise, we like to call it heroin chic, which unfortunately it's becoming. So a lot of your girls are going after the bad boys, and usually in the bad boy club, there's always the dealer. Today's age, the dealer is usually a heroin dealer. It's not marijuana dealers anymore. Meth is lower than heroin on the dealing range. So that number has gone down because these girls have not used prescription drugs. So a lot of your girls at 18 and 19, 21, that meet a boy. And all of a sudden they've used for the first time, now they're hooked. It's usually their 6th time using that they are left for dead by the dealer. That person that says they love them. Or it's that girl who was in the room with the overdose that now is all of a sudden going to prison because somebody died because she was the only one left there because she was too scared to run and didn't know what to do. So heroin is becoming the first drug picked up. What is recovery coaching? A recovery coach is a person who helps remove personal and environmental obstacles to recovery, links the newly recovering person to the recovery community, serves as a personal guide and a mentor in the management of personal and family recovery. Such supports are generated by mobilizing resources within the recovery community or provided by the recovery coach where such natural support networks are lacking. So I like to describe recovery coaching as like the San Francisco Bridge. So on one side of the bridge, you have people coming out of the prison system, coming out of the jail, they can't get treatment. The people that are waiting for beds in treatment centers, the people that are waiting for outpatient services, the people that can't afford to get any treatment. And a lot of times I like to include those family members. So those family members who have lost people, the family members that their kids are in prison, they have nowhere to turn, they don't know what to do. Just like your addicts and alcoholics, AA and NA can be a really scary place. Well, for our family members, Al-Anon is probably scarier. Because then you have to finally admit that your child has a problem. And so this community and Wisconsin is taught very largely that it's not my kid. So it's a shame that it is like that, but it still is like that, where a lot of family members are like, but it's not my kid. It will never be my kid. So where recovery coaching serves is you've got on the other side of the bridge, AA, NA, Celebrate Recovery. Those communities that are really scary to go to with a lot of people that are doing good, they're healthy, and they're sober. So when you're on the bridge going, well, I don't even know if I want to get sober. I have no idea. And I know this being in recovery myself. I teeter-tottered constantly. Like, which way was better? Why would I give all that up? But yet I should, because everyone's mad at me, and I'm so sick of being sick. But then the other part of me was like, why do I want to give that up? It's so scary, and when you're teeter-tottering, how do you know? You know, I started out going to AA and NA, and I'll tell you, my first time around trying to get sober, I relapsed to get out of it. That's the whole reason I relapsed. I didn't want anything to do with AA anymore. There was a huge book and a lot of people telling me what to do. And I never really went to church, and that word God was so dominant in the program that it scared me. And I ran from it. And my only out, I thought, was, well, I'll just drink. And I'll just sell drugs again. Because then they're not going to take me back. Because then I'm on this side of the bridge. So I'm just going to use. And then I don't ever have to go back to that scary place. You know, today, AA and NA have saved my life. I have a sponsor. But I also do recovery coaching. And I love it because it's so different. So what the coach does is they're like that person that starts out at the end of the bridge with them. And so we walk them the entire length of that bridge into a recovery community of their choosing. And so it's a lot easier when you learn to trust one person first, and then you can trust a community. And that person can tell you, we're going to go into a meeting that they're going to talk about all these things. I don't want you to run away and be scared. But if you want to leave, I'll leave with you. And then we'll go back next week. And then we'll go back the following week. So the recovery coach really does serve as that mentor that can kind of fill that gap at that bridge. I mean, you look at the wait time with somebody getting into services right now, and who's best fit to help you make sure they come in the doors. You know, right now, somebody may call, and I use Bell and Psych because we're partnered with them. Somebody may call Bell and Psych and they may say, well, we're 2 weeks out for you to start outpatient services. Well, okay, great. Guess what? I'm going to use. Like, I'm not going to wait 2 weeks. When I wake up hungover in the morning or sick, I want to go to treatment. And my mom's mad at me, my dad's mad at me. Now, if somebody says I have to wait 2 weeks, where am I going to go? I'm going to go to the bar. Or I'm going to go use because, hey, I got 2 weeks. Well, then what happens? Somebody dies. And then you never even get them into services. Or that person decides after 2 weeks, they're already so sick, why would they go to services? Because they're not getting detox. So why would you even try to start services? And then you have to be sober 24 hours before you get. Why would I do that when I'm about to change my whole life? So the recovery coach makes sense because they can see them through that whole duration. So at least they're getting the services. And at least you're guaranteed that you know that recovery coach that you're working with is actually going to be the one to drop them off that day. All right, so does that make sense about the bridge? Okay. What is recovery coaching? A recovery coach is not a sponsor. I have a sponsor, and she has told me that her only job in this life is my sponsor, and she's very old school. She has 36 years sober. She's a delegate out of New York. She is a big book thumper. And when I first started this, she was like, what are you thinking? Until I educated her a little bit. But her only job is to walk me through the 12 steps and to put me back in God's hands when I fall off track. And that is what she has always taught me. So that is not a recovery coach's job. We don't touch steps. We only discuss spirituality with you a little bit, or with the person a little bit, because it's only a small part of the case management plan we deal with. So it's whatever they choose. They could say the squirrels are higher power and they want us to go to the park and hang out with the squirrels, and that's what the recovery coach is going to do. They could say, I want to go back to church. I went as a kid, but I'll use our LGBT community. Perfect example. Since I came out of the closet, I started using drugs. My family is a huge Catholic base. They are against me being gay. I loved being at church as a child. But now I'm scared to walk into it because I heard lightning was going to strike me down because I'm gay. And I know I'm LGBT. This happened to me. So I'm never going to step back foot in a church again. Ever. So you may have a recovery coach. We have a large LGBT group, and we have 7 coaches in that group. And we work with tons of transgender. And guess where the coach goes? With them to church. And they sit with them. And if there's any derogatory remarks, and most of the time it's in somebody's head. Because let me tell you, we just got a sober living house from a church, and they've never even had a gay marriage there. They are not educated on LGBT, and they gifted this house to us to use, and I had to go speak in front of the whole congregation twice. And my worst fear walking in there, 6 years sober, and this just happened a month ago, was, oh my gosh, like, I'm totally gay. Like, do they know that when they, like, talk to me? Like, they have me talking to all these people, and what are they going to think? And, you know, after that, the pastors, and I actually go back and talk with the pastor now. I've been there 5 times, and we just go hang out, and I talk in front of the church. It's a lot of fun. It's a blast. But the pastor's wife had said, what do you guys think about doing Mandy and Jamie's wedding here? They've never had a gay marriage there, and they're approving it for us to actually get married there, which will be their first, which is pretty cool. But see, now if you didn't have a recovery coach with this person to make them feel better, where are they going to be? Because it's not like their counselor can go with them to church, and the sponsor's not going to go with them to church, because what if they believe in a different higher power? Okay, so recovery coach is not a counselor. Recovery coaches work really well with counselors. We are like counselors' best friends. And that's what I've learned, and social workers. There's areas that counselor can't touch in their lives. The counselor can't teach them how to open a bank account. They can't teach them how to go to Walmart and not have anxiety. They can give them an assignment about it and their anxiety. And it's not our job to try to give them assignments about their anxiety unless it's, hey, let's go to Walmart together. The counselor's not going to teach them how to do laundry or how to bake or how to make food or how to deal with their 6 kids now that they're sober without drinking. Like, it's not a counselor's job to do that, and it shouldn't be. The counselors do their jobs amazingly, and we kind of help fill that gap with the things they can. And so we work with so many counselors in Brown County, and they're always one of the first to call us.
Do you ever do HIPAA signatures with counselors or nurses where they can exchange
Release forms?
Waivers of liability.
The release forms?
Yeah.
Yeah, we do them all the time.
Okay.
We have to do them. We have contracts with CPS, juvenile, and throughout the juvenile jail, so we...
If they want to, if the person wants to.
Yep, we usually have a release form. And I'll tell you, those release forms work really well when, so like if, let's say somebody had to sign a release form between their probation officer to their counselor, they're a little skeptical, right? Mm-hmm. But when they know there's a release form with their recovery coach, our job is to advocate for them, not to hurt them. And so we're usually going to advocate the heck out of something. So let's say we had somebody relapse in heroin court, and I knew they were relapsing, and I knew exactly what they were using to pass the hair follicle test and the drug test. And finally it got to a point where I was like, maybe you should tell on yourself. Like, I'm not going to tell on you. You better tell on you. So like we went together to the PO's office, and now that person's doing it. I mean, they're 2 years sober, and had we not done that, like, now heroin court knows exactly how they're passing those tests. And so now, like, they do gelatin searches all the time. And they look to see, have you used white vinegar before your hair follicle test? And like heroin court wouldn't have even known, or drug court in Brown County, that how they're passing these tests. And I'll tell you, there isn't really one. We get consulted to talk to the treatment courts and stuff about ways to look for people to hide things, because I'm an addict, man. I hid everything, right? So I know how to pass all that stuff. So we've consulted them. So they hate, some of our addicts are like, Darjun, why you gotta go talk to them? We can't pass any of our tests anymore. Like, it becomes a big joke sometimes with our drug court babies down there. We call them our kids. I mean, even at 30, they're still like our kids. You know, they're 18, 16 in mindset. So a coach is not a doctor or nurse. We are not a clergy person. So 4 goals of a recovery coach is to promote recovery, remove barriers, connect recoveries with recovery support services, encourage hope, optimism, and healthy living. So connecting recovery with recovery support services, I like to put this in our resource brokering. So the main thing of a recovery coach is we're a resource broker. We're the first person that's going to know how to get you into North Central Healthcare. What does their bed weight look like? How many beds do they have? I think, what, you guys have 6? 7? 6. Okay, see? So I'm from Brown County and I know this. Do they have a scholarship for them? No. Are they thinking about implementing? Possibly. What insurance do they take? How well do they work with probation and parole? What are their counselors like? Who is that main person to call to get that person in quicker and on that wait list? So we teach our recovery coaches this. We teach them to know every resource in their county within a 50 to 100 mile radius. For Darjun, you know, I'm the director of all of our coaches, so I have to know every resource in the state and exactly what they abide by, every scholarship form. But then after the coach is in 6 months to a year, we start getting them out there a little bit more, like, let's branch out your resources a little bit. We have treatment centers that I work with in Arizona and Florida that we have had parents pay us to fly down to because I can get them in 48 hours for $6,000 inpatient. Self-pay, not 20. But we've already bridged that gap. We've already talked to those people. So it makes us really good resource brokers. And that's where recovery coaches are people's best friends. It's like you could call the clubhouse, and so Michelle's going to tell you probably more now where to go and where to get help and the quickest to get help. Even Tammy, better idea of where things are. Where are your sober living houses all over Wisconsin and which ones take out of county? That's a huge one right now. Because you can put someone in treatment, but then what? Where are they going to live? What do your homeless shelters look like? We do a lot of that. Like, we have a homeless shelter that we have consulted for a year, and they have 4 recovery coaches in there. And so when they open up, St. John's opens up in November, they have an AODA program. And it's not with counselors. There's one counselor always with the mic on St. John's, but it's all recovery coaches. And so they intake them into the homeless shelter, and we have a sober room now in that area for people who want to get sober. And they have tons of rules, and they all get a recovery coach. So when you know those areas, you have some better resources, even if you have to outsource. So, encourage hope, optimism, and healthy living. That is one of our biggest areas as recovery coaches. Also, we go into something in training called object, recipient, and resource. And so a lot of times our addicts out there, unfortunately, are treated like objects. And so when you can treat somebody like a resource and they're on the same playing field, it's easier for them to get, to obtain gratitude and humility. And so gratitude and humility will always lead to sobriety. But if you have somebody telling you what to do and you already hate authority and you're already defiant and it's a lot of should, you're apt not to listen. Like, if my counselor said, you need to get rid of all your friends on Facebook that you dealt with and blah, 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 and you need to get rid of all those friends, and they're taking all these things away from me, I am going to headbutt that. And I might tell the counselor exactly what they want to hear, and that whole 30 days, all I'm going to focus on is getting out of there. That's all I'm going to want to do, is get out of there. So I'm not going to give everything, and I'm going to stay in the middle, and I'm not going to give nothing. But I'm going to do what I have to do to convince that treatment center that I'm all right. Because I've already been shoulded. So now when you treat somebody like a resource, it allows them to open up more. It allows them to be honest. And it allows them to trust. And so usually you're going to get a longer term sobriety out of that. And that's where your recovery coaches come in, because they do that. That's a big part of our training. So we teach these guys, nobody is an object, right? You know, they already treat themselves like objects. So defining the lanes. A recovery coach is vetted by the community or organization, varied degree of supervision at Darjun, and I have to speak on Darjun because it is our organization, so I know what we do. We have a large supervision, we have a manual we follow, we have policies, we have procedures, we have all of that built for our coaches. A lot of places don't yet, but we're helping them. This is in some states it can be a very free-for-all thing, recovery coaching. You can have coaches that go out on their own, they don't have liability insurance, they can do what they want, they're a recovery coach. We vet it specifically so that we can actually help counties and that there isn't that problem area in there. Because there's still a hefty liability with it. And so that's why we hold liability coverage. Works across multiple frameworks of recovery via choices of those with whom they serve. We are person-driven. So not everybody gets the same plan. We believe in the individual. Minimal power differential, focus on present. What can you do today to strengthen your recovery? Where the counselor focuses on what happened. How can we better help you? Let's look at what happened with everything. Where we work well with counselors because we're like, what are you going to do today? Focus on linking to community resources and building recovery capital. So that's what we're doing in Marathon County today. We did it in Brown County. So right now, recovery capital is in the deficit a little bit. So we like to talk about recovery capital as like a bank account. And so when that bank account goes into the red, there's problems. And if the bank account sits at a low balance and doesn't gain interest, there's problems. And then you have a stalemate. So building recovery capital in a county looks at, how high can we get that bank account so that we can actually gain some interest out of that account. And then we don't have to worry. And so that's what your coaches are. They're your recovery capital for this entire county. So, works in paid or volunteer role. Our coaches we have a staple on it, so it's $35 an hour because they're not an addiction counselor. And if you need an addiction counselor at $100 an hour, you should go get an addiction counselor. That's why they go to school. That's why you spend all that time going to school. And I know I have had my second. I decided not to renew because I love Pure Sports Services. But we don't believe in charging as much. People can't get services right now, and a lot of times our people don't get paid. Most of our coaches are volunteer. Like I was saying, Chris, one of our coaches that came through the WASA training, he gets paid in smoothies and change. And so, but I'm the biggest one to say that we have the largest amount of coaches in the state because we're the dinosaurs of this. We're the ones that built it, and it's about time our coaches get paid. Because you can only run around for so long volunteering. And we just got a grant with Bell and Health to put the recovery coaches into the hospital system for $75,000. So we do have 7 paid coaches going into that hospital. And we do have 8 paid coaches on our county contract right now. So we're slowly starting to implement paid coaches. So sponsor, vetted by reputation within a recovery community, no formal supervision, works within beliefs of a particular recovery fellowship, relationship governed by group conscious, no external accountability, duration of services can span years, minimal focus on ecology of recovery, minimal advocacy, no fees paid to sponsor or recovery fellowship. Your counselor, emphasis on formal education, theory, and science, works within organizational hierarchy, works within a particular organizational treatment philosophy, significant power differential. Like they could pretty much tell your PO like something and then you're in big trouble. Explicit ethical guidelines, high external accountability, self-disclosure, discouraged or prohibited, considerable focus on past experience, duration of service becoming brief and even briefer with all the paperwork the state is handing down now. Paperwork extensive and burdensome. Works as paid helper, client, or third party pays for service, which we all know third parties are not paying what they used to for services in the AODA area or mental health.
Hey Mandy, I know the last session that we were in, someone asked if a clergy member could be a recovery coach. And they asked if a counselor could be a recovery coach because of ethics and boundaries. And so we talked a little bit about that.
Yep.
So the answer is,
you're a counselor.
I'm a licensed professional counselor. and I'm also a recovery coach. And the recovery coach training helped me understand, define the lines, so I felt more comfortable in this role and the distinctions of this role. I work for North Central Healthcare. So there are some lanes that I need to stay within, but definitely understanding how I can support and promote this and use it within my practice. Not just have an understanding of it and awareness and talk about it, but really use it in my day-to-day with our members that are coming in and struggling with recovery needs. It's possible. And I don't know that that's clear to our community, that you can have these other roles. In our training, we had people that ran treatment centers.
Jamie, perfect example. Ran the mooring program for 20 years. He's now one of Darjeon's recovery coaches and retired.
We also PD officer sitting in training. So it was a great group. And all of us, by the end of that training, that 4-day training, we understood what staying in our lane meant and how we could still use our recovery coaching to help our community. It's not called a liaison in Marathon County. Jail social worker. Rhonda
is a recovery coach now. She's awesome.
She's awesome.
Yeah. So this training really helps you to find the roles in that. We have a lot of counselors and clergy guys that are underneath us. We actually have one of the psychiatrists with Oneida is one of our recovery coaches. And he does it part-time on the side. And he doesn't get paid to do it because he doesn't want to get paid to do it. He just wants to give back. And he was one of our first ones we implemented in the jail, so the jail would laugh. And because some of the background checks we gave him, they were like, Mandy. And then they got his, and they were like, but he's a bigwig at Oneida. I'm like, but he wants to go to the jail and do recovery coaching for free. Don't deny him. You didn't deny our felons. Because they were all confused by it. Why would somebody in that kind of work want to just do this? Well, he's got 32 years sober. That's why he wants to do it.
So who usually pays? We do ask the peers to pay, because I have a lady that she would do anything for her daughter. So is it like the organization that pays that's doing the transitional out? Is it the parent?
For the coaching?
Recovery coaching.
So it all depends, like we do, so CCS for us now is third party because it's billable through Badger Care. And then we have the grant money that comes down and the county pays for our county contract stuff. But as an individual coming in, like we have one woman right now with CPS and CPS pays us to see her. But now her boyfriend, they don't pay for it. So she told him, you have to go see a recovery coach or I'm dumping you. And so she told him, you're paying $35 an hour or you're breaking up with you. So he sees one of our recovery coaches for 20. We do like how much can you afford? But we have a lot of moms. We have a bulk session plan with Darjeon. It's really affordable. So I think it's like 8 sessions and it's $260. And with that 8 sessions, that's 8 face-to-face. So that may be even FaceTime with Facebook or Skype. But unlimited texts and calls during that time is not charged. It's all as a package deal. So we have a 5 coaching package deal and an 8, and then a single session.
I'm doing volunteer now. I'm just talking about like Badger Care, things like that. Do they pay for it?
Well, so Badger Care will only pay under CCS right now. The worst thing that happened is a year ago I found out that it is ICS and IC approved in a bunch of states, and Wisconsin wants to adapt their own models, so they're not abiding by the fact that this is approved through the United States as ICS and IC. So we are about 60% there with the battle with the state right now. Me and Michelle from Grassroots Empowerment and Caroline from Voice of Recovery and Step Industries on fighting the state on that. So we've gotten as far as it's billable under CCS right now. And I think they did that to just hush me for a minute. But we're going to end up getting our way because I don't know why we wouldn't.
I think the one thing that you stressed in our training was this: at this point in Marathon County, it's not about making money or billing. Eventually that will come, but it's about, in the end, saving a person's life. And so we will get paid by lives saved in our county.
Yeah, and so...
That's why I volunteer. That's why I was just asking. Badger Care is like huge for transitioning people,
So here's the thing, is like, and I learned this really strongly with my father being in business here in Marathon County. Like, we didn't always have what we had. Like, he had to beg a bank to give him a loan to buy Norland for my grandpa, and like, I just remember being a kid and watching him go through that. And so I knew when we brought recovery coaching to Brown County for the first time, like nobody was just gonna give in and pay us. Like I wasn't stupid. I have a felony. I'm trying to prove this, you know. And we did do services for free for 2 years in that county, nonstop. And so guess what happened? We fixed a lot of the county's problems. The ERs don't have as long of a wait time. The CPS workers are not getting stressed out because we see so many of their people. And the kids that come down from the juvenile jail on their furloughs to Darjun, it's just amazing to watch them like hang out with some of our people that have been in prison and trying to help them. And so in-kind service can sometimes be better than monetary service. And so because we ran around doing this for free, you know, you can't expect to get anything right away until you put its worth out there.
Right.
And so like Norland
She
grew.
wasn't gonna give anything, and I'm like, no, no, no.
Yeah.
Because she was gonna drive in from Unity, and I'm like, no, it's just fine,
Yeah.
you know.
And so our family company here grew because my dad sucked it up for so many years. And so
Let's go.
at Darjun, we sucked it up for 2 years. We're still sucking it up, let me tell you. We're still running around trying to pay bills all the time. But you know, we've seen so many miracles that would have never happened not having that place. Like people that never, like 2 out of the 40 most chronic in the homeless population are sober. One of them is one of our recovery coaches. In the county, I sat in a meeting one day where they said, he will never get sober. He's on our 40 most chronic list. Well, why not? Well, did you even ask him what he wants? Well, no, what do you mean? Well, ask him what he wants. So we asked him what he wants. And he told me exactly what he needed to get sober. And he didn't want to go live at a homeless shelter. He loves living in his tent, man. He's like from the 60s. Loves his tent. Loves nature. But he's sober. He still lives in his tent. Still homeless. Refuses to get housing. Doesn't want to get housing. Could care less. But he's sober. He's not a problem. He just lives in the woods. And he hangs out at Darjun all the time. Sometimes he sleeps in our building. But he's sober. A year. But the county said he'd never get sober. We didn't say that. We said, what do you mean? Somebody's going to get sober if they want to get sober. It doesn't matter whether you label them the most chronic. If they want it bad enough and they have a guide to help them, they're going to quit. I was considered, when I was a level 4 offender, they said I would never get sober. Prison wouldn't help. Treatment wouldn't help. Nothing would help because I owned 2 bars and I sold drugs and I drank since I was a kid and I was abused until I got adopted and I was that scenario of you'll never get sober, right? Well, I'm sober 6 years. I'm the only one that made it out of our treatment center. And I was in there for 7 months, 11 days, inpatient, let me tell you. And so every group that came through, I'm the last man standing. But it's because I got grateful. And it's because I cared finally. Like I care how my family feels about me. I didn't care years ago. Could have cared less how my mom felt. I never conscious about it. So then I got humility. And humility really helps you give back. Like everyone always asks me, Mandy, why'd you create Darjun? Simple. I had a judge let me out of a courtroom on a 5th DUI, gave me my felony, and didn't send me to prison because he saw such a change. It was a miracle that happened in that courtroom that day. And so when I left and went back to Florida, and my probation didn't transfer, and I had to come back to the nightmare I created here in Green Bay and in Wausau with my family, I had already learned so much gratitude and humility. Why would I go back? So Darjun got created because my sponsor said, so now you've made your amends. You have one last amends to make. How are you going to make amends to a county that gave you 2 liquor licenses and you blew up a truck, kicked one of their cops in the privates, and they made an example out of you all over the newspapers? And so I opened Darjun. I couldn't think of a better amends to make to a county than giving back free services to help fill the gaps with addiction resources. And so I made that amends. And it was my last amends to make in my program, being in the 12-step program. Let me tell you, I wouldn't have done that 6 years ago. I was looking for ways to still get my liquor license back, even though they took it.
Mandy, just a quick thought on payment. You know, there is some evidence that for a person to pay just a little bit is the value of the service.
Yep.
So if they paid a couple bucks or $3, that might they might have more skin in the game
Mm-hmm.
if they're able to do that. You know, not that you have to insist on that, but I think, you know, to kind of think that way is not bad.
Yep, it is a good way to think. Like CCAR will say, when they have people going through training, unless they have an organization pay for it, if somebody is individually going through training, they tell us as trainers, we are not allowed to accept under $400 for a person going through training. Because that's the coach you're gonna get. The more skin they have in the game.
Right.
So we are not allowed to accept under $400. We're allowed to bid things out different for organizations if they're coming in as a whole group. But on an individual, it's 400 or up. Because, and we tried this, so Jesse and I in the training, and we were like, wow, whatever they say. So we charge people $150. Those are the worst recovery coaches we've ever had, man. They've all relapsed, they don't care, like they wanted to get paid $100 an hour. So you go up $400, and our coaches could care less if they get paid. I mean, they care sometimes, but they're the first one to run to a crisis. So yeah, you're right, it's more skin in the game.
Just a time check for you, Mindy, in about half an hour.
Okay, we're almost done.
Just to keep in track.
So, what is a recovery coach? We're a motivator and cheerleader, role model and mentor, problem solver, resource broker, which we went at over, advocate. That is a huge word. A lot of times, our recovery coaches go sit in court with people. And it's just because we want to be in court with them. They need someone to hold their hand through it. Their parents may not want to go to court with them. And Brown County now kind of has this thing where we do advocate, so we'll write letters for our recoveries to the judges saying so-and-so is with our services, you may not know about our recovery coaching, here's what we do. And we do offer our opinion. Like I'll say, I don't think so-and-so should go to prison for a year, this is why. I had a DUI, a judge let me out of a courtroom, had I gone to prison I wouldn't have Darjun today and I wouldn't be sitting in your courtroom helping this recovery. And I'll tell you, now with Brown County, if a judge sees a Darjun letter, they usually let them off. Or they'll let them off halfway. Or they're the first person they'll put into the treatment court for
I
us.
just wrote a letter to a PO officer and told him that she had a recovery coach, and the PO officer said wasn't going to go to jail. So it works.
Yeah,
Well,
it
that's
does.
probably because Ron Disaster probably told everybody in the jail that what a
Yes, she
recovery
did.
coach was. You know what I mean? But
Yeah, and our POs love us, man. I mean, some of the POs don't love us so much.
I worked with them.
But a lot of the POs do.
So,
And they'll call us. We had one PO with a girl, and she was like, Mandy, I'm trying not to revocate her here, man. Give me a reason not to revocate her. And I would go in her office constantly with this girl, and she kept relapsing. And I'll tell you, the one time I did sit in a PO's office was this girl, and I said, yup, she needs to go to prison. Send her to jail now. Person came in, took her to jail. She's in prison right now. She still writes us all the time and asks me what she's gonna do when she gets out. And she wasn't so grateful then. But now she's pretty happy she's in there. But sometimes the recovery coach does work in that favor. I have no problem telling a judge when I think somebody should go to prison and they are just messing around and manipulating the drug court. We have made a lot of decisions that Judge Walsh can't make in heroin court. After they've lost 4 people, sometimes we'll get a call and they'll go, Mandy, this one, da-da-da-da. And I'll be like, Judge Walsh, send them to prison, man. Get them out. Kick them out of the program. They gotta go. They're never gonna learn. And then the one that maybe is really the troublemaker, I'll look at him and go, no, there's hope. The more defiant that person is, usually there's hope. I know, because I was defiant. Just treat them a little different this way. And so they have these recovery coaches to help them make these decisions, and they listen, and that's pretty cool. So, community organizer, lifestyle consultant, friend and companion, and most importantly, the recovery coach is an equal. So, the training and what it provides, the CCAR Recovery Coach Academy. It is only 4 days now with Darjun. I've done a lot of these trainings. I have 172 coaches I've trained. So we managed to pull it off in 4 days and get everyone out of there. I don't like taking people off work for 5 days. If I could, actually, we are kind of guinea pigging this, but we're trying to get it down to 3 days. So me and Amy have been practicing, and we probably can, but it's gonna be long days. So 30 CEUs are offered for this training. focuses on providing individuals with the skills needed to guide, mentor, and support anyone who would like to enter into or sustain long-term recovery, provide in a retreat-like environment, which now we're doing it at a golf course this time. The C-CAR Recovery Coach Academy prepares participants by helping them to actively listen, ask really good questions, and discover and manage their own stuff. So, competencies are: describe recovery coach role and functions, list the components, core values, and guiding principles of recovery, build skills to enhance relationships, explore many dimensions of recovery and recovery coaching, discover attitudes about self-disclosure and sharing their own story, which is a learned trait. You find in AA and NA a lot of times, and I know personally, when they tell you to go tell your story for the first time, sometimes you don't know what you're doing and it's very scary. And you can screw up sometimes. I remember when I used to start speaking and public speaking, I would screw up all the time. And so when I actually got taught the correct way to share my story, oh my gosh, I never really got nervous again, and it helped out a lot. And so we do a lot of this. How do you share your story in our training? Understanding the stages of recovery. That's a huge section we go over. So how does somebody at 1 year sober act compared to 5 years sober? How does somebody at 6 months compared to 3 years sober? And I know that in addiction counseling school you go over this, but we go in depth of this a little bit more. So describe the stages of change and their applications to how that person is changing and why. Increase their awareness of culture, power, and privilege, which is another huge section. Like I talk about all the time, is like we'll have coaches start training with a lot of bias. In the WASA training, it got a little heated the first day over medicated assisted treatment. By day 4, there was no more bias around it. And trust me, we had to talk a lot out. It was probably the one training I had the most ouches in. That I guess I never heard. But we had a lot of ouches in that training. And so we go over culture and like, how does it differ with an African American individual to your typical white individual? And how does it differ between your Hmong population? And why don't you see very many of those people in our treatment centers or in our outpatient programs? And we go over all that. And what does the family heritage look like? And how many people actually live in a household? And what families create community within their culture? And what families don't? As white, we do not have any kind of community in our households at all. But why would you never hardly see anyone of Hmong heritage come in? They all live under the same roof. It's community. Family takes care of family. And so we teach these guys a lot of how that works. And it's another training that me and Jesse provide throughout actually the United States. We do it in Detroit all the time. We hold a huge cultural intelligence, humility, and competency training. And so it's a huge area that a lot of people don't know a lot about. How should individuals be treated differently? So if we're person-centered and we're individual-centered, you're going to treat somebody differently that's coming from an African-American background than you would your typical white kid living in a home that the parents make about $150,000 a year. There's a lot of difference there when you're looking at that addiction area. And you don't want to step on toes or hurt them, because a lot of people will say, well, you're hurting my family if I have to do that. So, address ethical and boundary issues. Our coaches do have to follow boundaries and ethical considerations. We go over some of this in training, and we put together some scenarios for them, like, when do you know when friendship is drawing the line with a recovery? What do you do if there's a relapse? What do you do if you're the coach and you relapse, which is the biggest one? Is as the coach, what happens? Because it happens. It happens with counselors. It happens with county people that work that relapse. Although I think there's more openness, obviously in a recovery community organization than there would be with a county worker that may say, I'm never going to tell them that I have 20 years sober and that's why I'm actually in this job in this field. I know from our jail liaison in Brown County, not a lot of people know she's actually sober, but they sent her to recovery coach training. And she's one of our best coaches because of that. So a lot of times we aren't allowed to say certain things in job fields. Experience recovery wellness planning. We do follow a case management plan. It has 8 different areas in that case plan. It kind of covers their entire life at that moment. Even down to, how do I open a bank account? How do I get insurance? How do I go to the ARCW to get tested to see if I have HIV or Hep C? Our coaches go to the ARCW all the time with our people. We love the ARCW. Once a month they come do on-site testing for us at Darjun. So when we get a new batch of recoveries in, we put them in the basement. They all get tested. The recovery coaches are there with them. We do it right at Darjun now. We don't even do it there, just for their privacy. So.
I was wondering if you guys did that. I didn't know how the office works, but.
Yep, we get a lot of referrals from the ARCW, especially with our LGBT community stuff. So, yeah, we love the ARCW. In fact, in Green Bay now, so if we do a training in Green Bay, they're the Narcan training provider, so we call them in whenever we need them. They now allow me to show the Narcan video, and once the training is done and they see the video, they go ARCW and pick up their Narcan. So, it works pretty nice. Practice newly acquired skills. Recovery Coach Academy. The training is open to anyone who is interested in being a recovery coach. Oftentimes, family members and supporters are the best to be able to connect with other families. We love our mom coaches. We have a family division, and we also love the allies. So I kind of explained this in the last one. Some of our social workers and our child protective services workers, we talk to them all the time, and it's really hard for them to have tough skin around the issue because they don't know, right? Like, they may not have a direct family member of, and it's breaking their heart when they lose clients. It's breaking their heart to take away these kids, and they just don't understand, why can't they just get sober? I don't get it. So we help a lot with that, but we put a lot of our allies through it. The training, we had 2 CPS workers go through our training for Brown County, and they did it not to actually have them be recovery coaches. They wanted them to be a little tougher around the issue because they didn't want to lose them as CPS workers, and it was so close that they're going to walk out of the job. So now they're really great CPS workers, and they call them out on their crap all the time. But, it's about having that tougher skin. Like, I might have a tougher skin around this than most people because I watch my friends die all the time, but I also get it. Like, I get why somebody overdoses intentionally. I get it. You can't get out. And so, like, a lot of us in recovery, I know a lot of my friends that I work with talk about it all the time, and like, it's kind of the point where we view it when somebody passes away. We don't even go to funerals anymore, but when someone passes away, well, okay, so that addict has more power up there than they had down here. And so that's how we view it now, because we're losing so many of our friends in the program. It's insane. It's just, heroin's worse than it ever has been, and the stuff they're mixing it with is just killing people left and right. So you get tough skin around losing people. You really do. And so it helps you actually help an addict better when you have that tough skin. The next training is in Wausau, October 30th through November 2nd. It is going to be held at the Old Legion, what is it called now?
Tribute.
Golf course. It's $50 through AOD Partnership.
Thanks to North Central Healthcare Foundation and the Spirus Health Foundation.
Yep, which sponsored the last training too.
Yes.
Thank you. You guys rock. Okay, so hope of recovery. Let's look at some examples from New York. So CCAR drove this so far that on the entire East Coast you have recovery community centers that are recognized by Face and Voices of Recovery out of Washington. And so their only job as an organization is to help us be larger organizations as recovery community centers. And so we are one of the 4 approved in the state to actually be a recovery community center out of Washington, which is why we're the state network for recovery coaching right now. So all of these that I'm about to show you are approved ROCs, so recovery community organizations through FACES. So all of these guys have about 40 to 80 recovery coaches paid on salary that work with them. And the main places that they get their funding from is not the state. It's actually hospital systems and your psych centers and your counseling agencies and the family members of. And that's where their main donations come in, is because I mean, I know from ours, partnered with Bellin Health, we help Bellin so much. Like, they help us a lot, but sometimes they're like, we wouldn't be where we are with our rates right now if it weren't for you guys. So, outcomes achieved, 68 increase in competitive employment, 43% decrease in ER visits, that has risen now with recovery coaching, 44% decrease in inpatient days, 56% decrease in self-harm, 51% decrease in harm to others, and 11% decrease in arrests. Out in New York, they will call a recovery coach to do a ride-along with a cop for any AODA issue and with crisis. There's a crisis worker, there's a recovery coach, and there is a mental health officer. In Brown County, we are getting there finally. We have mental health officers. We are called along on ride-alongs along with the crisis center. And it has to be an AODA issue, and some of it is on our overdoses where a parent may find their child dead. They will call a recovery coach automatically. Because our mom recovery coach that just lost somebody 2 years ago is going to help that mom better than any crisis worker. And I don't mean that because crisis workers aren't amazing. Crisis workers are amazing. But when you have a mom that gets it, it's usually lived life experience. It also helps when the recovery coach can talk somebody down. So we had an issue where somebody was about to get tasered at Darjun because he was scared. He was high on meth and he was schizoaffective disorder and he didn't take his medication. And so you add that all in, and he just came out of the closet and he was like, yay. So he was a mess, right? And so the cops came in, we called our mental health cops in, but he was about to get tasered. But it took like my guy behind the counter to be like, you know, so-and-so, you need to calm down, like, here, get it, look at me, get it. I was in your place, remember, I just got sober up meth a year ago, man, you just need to calm your head down. The kid didn't get tasered. I mean, he went to the crisis center, but he didn't get tasered. So, Anchor ED, this is a huge organization. And they have 80 recovery coaches employed with them. And all of those recovery coaches make between $13 and $17 an hour on a pure rate. But Rhode Island Anchor ED program in 2014, a total of 232 people died of accidental overdoses in Rhode Island. 7 months after the program began, 112 survivors of overdoses in hospital emergency rooms were seen, and 88% of them engaged in recovery supports. Recovery coaches are on call 24/7 at Kent Memorial Rhode Island Hospital. The survivor, a clean-cut young man, about college age, overdosed while driving and caused the car accident. The story began. The recovery coach connected with the survivor, helping him understand the severity of this near-death experience and cultivated a willingness from the survivor to get help. In our grant, Bellin put our coaches on call in that grant. We have a female coach, a male coach, and a family coach, all on call at the same time. Because you never know which one you're going to need, especially if somebody dies. So if the family's sitting in that hospital room, we're going to call our family coach in. So Minnesota has their own recovery coaching program that the state implemented. And so they have 640 volunteers, number of volunteer hours, 18,129. Time spent volunteering, recovery coaching, 28%. I can tell you Darjun's is around 58%. We've already started on some of these numbers. We have 68 coaches through the state, though, and most of them volunteer their time because they're unpaid right now. TRS, 26%. Administrative volunteering, 19%. Special events, 18%. Celebrating families, 3%. Outreach, 2%. And other, 2%. So, that is the recovery coaching, what it is, presentation. Do you guys have any questions?
Is it feasible for somebody working a full-time job to 9 to 5 or 8 to 5 to be able to be a recovery coach?
Oh yeah, we have tons of people that work full-time that are recovery coaches. You set your own hours, and so you have your boundaries you have to set. Like for me, I used to do it all the time, and then I got engaged, and she has kids, and I was told I can't anymore. So now, you know, I can only take calls till 8 p.m. but you can do whatever hours you want. You can recovery coach once a month. Any other questions?
Do you know if there's a third training coming up here in Wausau at all in the works?
I know there's a second,
Yeah.
and I don't know. That would depend on our partnering agencies.
Well, I had mentioned in the beginning of our conversation today that November 8th is the next summit, recovery summit, which is really about a year ago, last November, is where we met and we started this community conversation about what we needed. So that conversation is going to continue in November. So my hope, expectation is that the recovery coaches will be present at that meeting and share with the community our vision, our plan, and start building this framework about where we want to go, which would include additional trainings. How do we support the recovery coaches in their current roles so they get continuing education? I know Mandy is committed to working with us through this process for the next year, that we have support with you and supervision under you. So, but we're just starting this. We're just starting this process, and we're designing it. This afternoon at 3 o'clock, we have our follow-up from our training at Community Corner Clubhouse, which is located at 811 North 3rd Avenue. So if you are interested in being part of that design of how we're going to implement this, including additional trainings, you can come this afternoon at 3 o'clock. But stay tuned.
And Darjeel's also in taking donations right now. We're a 501c3 to actually put a location here. So the sooner we can get some donations and get hopefully a couple partnering agencies, the sooner we can get a drop-in center like we have. And ours is really kind of cool. I mean, we have food, but it's, you know, we're downsizing that a little bit. We've learned people just like things that are on like we have a value menu now, like McDonald's. And we have a pool table, and we have dartboards, and we also have confidential meeting room. You know, it's out of an old bar. And so right now we're kind of looking at that scenario of what C-Car does. And so we are like a mini C-Car. And right now, you know, C-Car operates out of 3 old houses. And they have a youth recovery coaching house, and then they have 2 additional houses. And so that's what they operate out of, is an old house. And it's usually easier to get an old house that needs a little bit of work, and it's cheaper to run out of than an old barn. So that's kind of our looking at for Wausau right now.
Mandy, you do recovery coach training outside of Wausau, like maybe in Green Bay or Oshkosh. Is it possible for a Wausau person to go to another training, or are they kind of closed training? In other words, what would it cost for a person from Wausau to get in on STEP or another type, you know?
Okay, so we arrange Wausau a little bit differently. It's become like our baby at Darjeeling, like we love Wausau. But like, so Wapaka, I just got contracted to do Wapaka training.
Right.
I can put people through Darjeeling through that training in Wapaka, even though they contracted it, but I can only put up to 5. Other than that, I know we're putting a next training together at Darjeeling. A lot of people like it there better than STEP sometimes because we have that community organization feel. And then they just pay for the training, so it's $400 for a training.
Right, so if they wanted to go and they could contact you and you could tell them possible opportunities.
Yep, we have an email list right now of 40 people that want a training. And so I'm being contracted out so much that it's been hard to put one together, but it's sometimes easier to just be contracted out. Because it's cheaper on an organization to just go, hey, I want to train 30 recovery coaches. Can you imagine 30 people at $400? It's like, that's a lot of money. And I'm not allowed to come down on a $400 price at all from a C-Car, but I am allowed to come down with like this. So, yeah, they can go to whatever training they want. Any other questions? Now would be the time to ask. Any questions around liability insurance? Anything like that?
So Melissa will be here this afternoon. There's a third session that Mandy will be here to talk to community members about recovery coaching. So if you have applications, She'll be here to sort of answer questions. The best way to get them back to her, if you have filled one out, is you can scan them in and email them back to her, or drop them off at her location. But there are applications at the front table.
We also have our recovery coaching services brochures up there that kind of outline what we do with services and what's actually implemented in those services. That are June brochures on the community center, the donation jar, which anything today is being allocated to a restricted Marathon County fund. And we have already started allocating money to that fund. And we have magnets that got donated for your fridge and my business card, if you guys need anything. We do consulting work for agencies also on what does it look like to actually help house coaches. How do you put them in? Lately I found with our consulting work, everybody's just like, let's just let it be Darjun, because we already have all the system and we're licensed. And our attorneys are actually here in Wausau, and our accountants, which are nice. We have Ruderware and Whiffley. So we do everything with them. So we're licensed for everything now, and in the process of trademarking. So.
No other questions, thank you.
Yeah, thanks, Lane.